The aim of my presentation today is to show you that social methods like social surveys or the questionnaires, if they are well adapted, if they are suitable for measurements, you can use them very good in a way that psychiatric patients can express themselves about the hospital experience. And this is also very important when you do a change in the systematic way. You should measure this experience in a quite consistent way. So we did first assessments, and I will tell you the results. But let me first start from the method. We took the example from the Norwegian group of the researchers, and here's the source I written down in the slide. Bertjes and Hilde Hestad Iversen and Johanne Kjølstad, and they created in 2014 the questionnaire, which is abbreviation PIPE-QoS, is an instrument for on-site measurements of the experience of inpatients at psychiatric institutions, and it's published in the open source, and you can also translate it into many languages. So we did a translation into Lithuanian language, and also we did translation into Russian language, because part of our patients are Russian speaking, and we want to have the real assessment of our services and their opinion in their mother's language. The questionnaire is quite simple. It has 22 questions along the 3 scales, and 3 scales are structure and facilities, patient-centered interactions and outcomes, and it's rated on a very easy 5-point Likert scale. 1 is absolutely no, 5 is absolutely yes. So it's quite easy to patients to understand what the questions are, but also for the people with intellectual disability or people with organic brain syndromes, we use those faces. And our nursing staff and also our occupational therapists, they explained the question has been asked, and the person indicates then which face is the right response. Also for children and adolescents is also important, because we have the department for the adolescent and usually treating young people with first episode psychosis. For us, it's also important to know their opinion. So summarizing our research, we started in 2019 and made I think it was response rate 35 because we just started that year, but later on we aimed to have more than 70% of the response rate. So you can see that gradually in year 2021, we reached that aim, and 76% of our discharged patients, they responded to this questionnaire and anonymously, and we have the online form, and nurse or the occupational therapist at the ward before the discharge of the patient, they gave the PC tablet, and with the tablet or the PC which stands in the occupational room, patients were filling in the questionnaire. So the pandemic also has an interesting effect on the hospital, because since March of 2020, our number of patients has been dropped, and in March and April we had to stop some wards, for example, gerontopsychiatry, but later on we resumed our services, and also we have been very actively supporting our national health system in the way that also we treat corona patients, and we have the specialized departments for the corona and also mental disorders, because at the university clinic those patients sometimes are difficult to manage. So basically We also see in last year we have the highest response rate, but this year probably the staff was a bit probably not attentive and didn't ask sometimes. So we achieved this year 64% until the July. And also, I would like to show you that we have quite big number of the participants. So it's 9,300 during those 3.5 years. In this slide, I want to illustrate that our patient population is the most severe ill psychiatric patients, because in comparison with other hospitals, we have the highest rate of the patients which are hospitalized by the legal procedure against their will. And this percentage of the patients which are on the coercive treatment in our hospital is quite stable. It's about 5%. And it's this number above. 5.3 in 2019 and 5.1 in 2020, 5.5 during the Corona period, and now it has been dropped down to the 4.8. Also, in these bars, the percentages illustrate what is the proportion of the patients that has been hospitalized due to the coercive treatment according to the law, that they have been dangerous to themselves or to others or to the property and have had a severe mental illness. And the other bar illustrates that these patients were legally incapable, so they should be under the guardianship. But also we have the legal procedure that all of them we have been referring to the judge, and by the distant judge procedure, by the distant trial, the coercive treatment was administered by the judge. This is the questionnaire, and you can see 22 items. I can maybe read some of them. So, were you welcomed satisfactorily when you have been admitted to the institution? Have you had enough time for talks and contact with clinician personnel? Do you perceive that the clinician's personnel understand your situation? Have you had the chance to tell the clinician's personnel what is important about your condition? So these examples show that this is not very specific questions about the content of the treatment, but more about the behavior of the staff, and also about whether the staff is empathetic, and also other important items. Also, one item is about the medication choice, and this is the item where we have some troubles. I will show you in our results. So also the question 12, have you felt safe at the institution? And have you help and treatment you have received at the institution improved your ability? So now I would like to discuss more about the issues with the choice of the medication, and you can see that on the average score, this is the lowest score. So 3.8, whereby the others averages are around 4. And this is also the example of items across the year. And you can see that in the total outcomes, in the average, with regard to the 3 structures of the questionnaire, on the first scale, we have some mild improvement from 4.1 to 4.4, but our structure is very old. Our hospital has been built 120 years ago, and So we don't have still many investments from the state or from ministry to change from the inside. So we do everything by ourselves. And so what we can change is probably other important things. So patient-centered interactions also slightly improved from 4.1 to 4.3. And in the outcome field, also the same outcome was observed. So 3 items we discussed with our staff, because these measurements we are discussing regularly with our staff. The item number 8: have you had influence on the choice of the treatment regime? And you can see that there is an improvement from year 2019. The average score was 3.6, and in the year 2021 we had average score 4, and this year the same average score. The item 9: have you had influence on your medication? The initial assessment was 3.5, and it gradually now improved up to 4. And the item number 20: all in all, have you help and treatment you have received so far at the institution has been satisfactory? And despite the lockdowns and despite the also needed isolation in our hospital for patients with probable infection in year 2020 and in year 2021, they have rated quite well with scores 4.3, 4.4. Summary of our patients' remarks and improvement of care, that patients also can express in this computerized version of the survey, they can also write something. And many people wrote a gratitude towards the staff and towards the psychologists and nurses, and they also emphasized the role of psychiatrists. And also they pointed their remarks about the hospital setting, about the food, about the leisure activities, and many of them, they were good, but also some critical remarks. They were also about some leisure activities. Also, patients expressed regrets that they had too little attention from mental health professionals, and mostly from psychiatrists, because psychiatrists were too busy and they have no time for individual consultations, and we had some patients which complained about that. And also they wrote about the criticisms for inattentive or, in rare cases, rude behavior from the staff. So my hospital decisions were made on the improvement of care, that we introduced schedules for patients' leisure activities during weekends and weekdays, evenings also, and nursing council was very active. So we have nursing council, and also ergotherapists, occupational workers introduced this more activities. More active patient involvement into the treatment is regularly discussed with the staff, but this is still a very controversial and highly debated emotionally issue in Lithuanian psychiatry. And work processes are reviewed in order to create more time for staff and patients' interaction about this decision. And competences of nursing staff in the field of psychiatry and communication are periodically updated and improved. And patients' physical restraint measures are clearly defined, regulated, and transparent. And we have online system that every restraint measure, if they are needed to apply, they should be applied and written in our records, and we can control what was the reason for that. And any misconduct is analyzed. So my conclusions are that this survey motivates patients to express their experience and opinion about inpatient treatment, that it became part of the treatment process and allows to collect valuable information regularly and make changes accordingly. And these results bring awareness and motivate staff to improve professional conduct. And during COVID pandemic, despite significantly more distressing period, patients' experience of inpatient treatment remain relatively unchanged and positive. So I thank you very much for your attention, and I thank also my colleagues, Dr. Ieva Vaskelienė and IT specialist Eglė Mišeikytė, for doing this presentation. Thank you.